This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Hello, and thanks for tuning in here on this Wednesday morning. I'm Ryan Kalei-Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, Yunji, we are focusing in on a topic that unfortunately has made headlines not only here in Hawaii, but throughout the country.
That's right. We are really shining a spotlight today on the drug fentanyl and all of the pain it brings to so many communities, including ours here in Hawaii. We've brought the best of the best to discuss this today. So please welcome former Maui Police Chief and now Executive Director of HIDA, Hawaii High Intensity Drug Trafficking Area. That's a federal program designed to fight drugs here in our community. Gary Yabuta, of course, the Executive Director of that agency. Thanks for being here.
Well, thank you for having me, Yunji.
So let's start with the basics. And really, we wanted to have you on to talk about this because we increasingly see headlines about fentanyl. There were a lot around Halloween in particular, but consistently seeing more and more of this drug infiltrating our community. Let's start with the basics. What is fentanyl and where are people finding it?
Well, fentanyl is a synthetic opioid as opposed to an organic opioid, which is heroin. And heroin has been the staple of illicit opioids for over 50 years. The purpose of fentanyl, which comes from Mexico, it's made by the Mexican cartels, the violent Mexican cartels. The precursors for fentanyl and methamphetamine come from China, is that it's made at a cheaper volume than heroin. Because it's a synthetic, it's based on chemicals, whereas heroin, you have to grow the poppy, the opium poppy, and then you have to have an army to protect the fields, the poppy fields, and the production is seasonal. You have to harvest your crop, and you can only do this certain times of the year. Whereas fentanyl, because it's a chemical, you can produce it 24 hours a day, 7 days a week, 365 days out of the year. And it's much cheaper to manufacture than organic opioids or organic heroin. So it's a cheap product and it's highly effective. It's 30 to 50 times stronger than heroin, and it's coming to your doorsteps in a pill form, a counterfeit Oxycontin pill form. And they've made it colorful nowadays. So they're not trying to hide the product anymore. And that's what the danger is throughout, not only in Hawaii, but in mainland United States and other parts of the world.
Are there any areas specifically here in Hawaii that we're seeing more fentanyl use or more fentanyl-related fatalities? As we know, those have also occurred, or injuries that have come from it. But is there an area within the state that is more concerning because of the level of fentanyl that is appearing in the area?
There's no geographically prone area in Hawaii. It's statewide. However, anecdotally, I would say the Big Island has the biggest impact, and Kauai too. And these are rural districts. These are our communities that it's not an urban community. That's not densely populated, and they're getting the most fentanyl per capita cases and tragedies as well. We lost a 14-year-old girl on the Big Island last year from fentanyl.
Now, talk a little bit about, you did say that it comes often as a counterfeit pill of another kind. How are people generally consuming this? In other words, do they know that they are consuming fentanyl, or are they buying other street drugs or over the counter, or rather prescription drugs that are actually fentanyl instead?
Well, there's a different clientele class of users of fentanyl and fentanyl products. I would say that there's people that knowingly know that they're taking counterfeit fentanyl, and they have to, because beforehand they were given regular prescription fentanyl, Oxycontin from their doctors to relieve perceived pain. But the doctors, in compliance to strict federal regulations, have cut off a lot of their patients from renewing their Oxycontin prescriptions. And so now you have a whole generation of people that can't get their Oxycontin, but they need to have that formula. So either that they're habitually addicted to it or they want to relieve the pain. So they turn to the black market, and they know very well that they're taking this counterfeit fentanyl product. And there's also the people that don't know what they're taking, especially the youth. They're thinking they're taking something that is very new, and through the social media circuits, they're being promised that they're going to have a great high, a great time with this. And so they try it for the first time, not knowing how deadly fentanyl products are. And this is how it starts. It starts with the counterfeit fentanyl pills, and then it migrates to a need for a higher level. And then you migrate to fentanyl powder, and you start injecting it just like heroin. And that's even scarier.
You know, because this is a relatively new substance and something that has just recently been coming up and we're seeing more and more of, I imagine that it may be a little harder to get. How difficult is it for people who, like those you just described, who are trying to seek out fentanyl? How hard is it, or how easy is it for them to find those dealers on the black market? And how often are we seeing this exchange happen?
Unfortunately, not only fentanyl, but methamphetamine, ice, which is Hawaii's biggest drug problem, our biggest drug threat, methamphetamine. All of these drugs, MDMA, ecstasy, marijuana, it can come to your doorsteps by virtue of parcel delivery systems. And that's your U.S. postal system, that's FedEx and UPS. So that's how it's being ordered. It's being shipped, just like Amazon products, to your doorsteps. It's that easy, and it's overwhelming for law enforcement. And also, you get drug dealers on the streets. They're selling drugs the same old way that's been going on for the last 50 years. You know somebody that knows somebody, and you order your drugs and you buy it. And there's drug dealers out there that are enticing our people to try it for the first time for free. And once they start taking it, then they're going to have to buy it from there on out. So there's just so many different forms of people using this drug knowingly, unknowingly, and then escalating to the powder form of fentanyl, which, by the way, is so potent and strong, it doesn't also have to be injected. You can die of an overdose, and quite frequently by inhaling it, by snorting it like cocaine, or putting it behind your gums and so forth. So it's not just injecting fentanyl. It's through oral or inhaling that can kill you.
Let's talk about the lethality of this particular substance. As you mentioned, it doesn't take much, and we've seen incidents on the continent where officers have encountered this drug and needed Narcan, which is the antidote, even just through casual contact, if you will, not ingesting it intentionally, but perhaps breathing it in. Talk about just how dangerous it is to the average person who may come into contact with this drug or be trying it for the first time, and how deadly it can be.
Yeah, and more studies have to be researched to really give us a definite answer. I'm very pragmatic as a law enforcement official for the past 44 years. We may say that, fentanyl by contact isn't a problem. Inhaling fentanyl won't cause problems, but years down the road it may. So I'm very cautious. But the information that we do have now is that you don't have to overreact when you come encounters with fentanyl pills or fentanyl forms. Fentanyl doesn't float in the air, and fentanyl by contact with your skin is harmless. You just have to wash it off with soap and waters. And this changed maybe about 5 years ago. I went to the DEA Clan Lab Institute in Quantico, Virginia. And at that time, the response was to suit up in a level A protective equipment apparatus, which is like a spacesuit. So we've come some ways. We're being more aware that we don't have to become from a different atmosphere to come in contact with fentanyl. However, we do have to protect our mouths, so we should wear an N95 mask. We should have eye protection, and we should always wear gloves. And we should always remember to wash off exposures with just soap and water.
And so to go off of, as Angie had mentioned, the Narcan and the ability that that product has to save lives for those who unintentionally come into contact with this, how important is it for individuals to have access to Narcan and this substance in these situations? And what can you tell us about what others throughout the country are doing to prepare for this type of situation in the event that they do come in contact with fentanyl?
Well, yeah, fentanyl and opioids, the only antidote is Narcan, naloxone, and it's a wonder drug and it's harmless. And the FDA is looking to approve it over the counter. So that's probably our best defense to fentanyl exposures and to opioid overdoses in general. And it's safe, it's effective. In fact, our EMTs, which are highly trained here in Hawaii and in the nation, they apply Narcan to whenever they have a semi-conscious patient whom they might not have any evidence of fentanyl, but it's not going to hurt that particular patient by administering Narcan. So they look at the objective symptoms, shallow breathing, dilated pupils, but they'll go ahead and give Narcan just as a precaution. And the EMT officials here, Dr. Ireland, Ian Sante, have told me they experience about 1,000 Narcan applications a year. And out of those 1,000 Narcan applications, maybe 100 are bona fide fentanyl or opioid overdoses. So it's not going to hurt you, and it's our best defense for opioid overdoses. I practice it. I keep Narcan in my car, my office, and at my home. Mainland states are doing the same, have done the same. In fact, the Los Angeles Unified School District mandates that there's Narcan in every classroom. So it's a wonderful drug. It's our best defense. And you just have to realize that that's pretty much our only defense, even at our emergency rooms. There's no other type of treatment that can really counteract the opioids. And, at the ER and even the EMTs are using it through IVs to get the maximum potential antidote treatment for it.
When you're talking about people having this in the classroom or having it readily available, is this something that's easy to administer? And is this something that you would recommend the average person? I mean, is this something that should be restricted to medical professionals, paramedics, as you're discussing, or even people like teachers in those scenarios? Or is this something that you would recommend that people have in their home?
Yeah, I recommend training, and the training is very simple. I advocate training, and we have people that can train any audience. In fact, I've said all along, anybody that's 12 years or over should know what fentanyl is and what Narcan is too. It's easy to apply. It's pretty much putting the atomizer in your nose and depressing it to spray the Narcan in your nasal. So that's pretty much it. I do advocate training. There's YouTube training for it. However, we do provide training for that. The Hawaii Health and Harm Reduction Center provides training for that. But the bottom line is very easy to apply, and it's not going to hurt the patient. If the patient is suffering from some other type of illness or injury that caused semi-consciousness, it's not going to hurt that particular matter. So I believe in it firmly, and it's available, and we are ready to move to any type of community organization that wants it. The Big Island Fentanyl Task Force, Dr. Alameda, has already hitting the communities with the Narcan for availability. So this is something that we should do. And I'm not a Cassandrist. I don't believe I'm a Cassandrist. I'm very pragmatic. I've seen this coming for the last 20 years. And in the last 5 years, the fentanyl. So I spent a lot of time trying to prepare for this. 20 years ago on Maui, when I was a police officer, we experienced drugstores getting robbed by desperate people who wanted OxyContin. And we saw a lot of burglaries, people breaking into pharmacies just to get OxyContin. They were that desperate. And I knew 20 years ago, wow, we have a problem here. Because what they were doing with the OxyContin is they were pulverizing it and spooning it, liquefying it, just like they do with heroin. And they were injecting it just to get the high that they needed to get them through the day as addicts. So 20 years ago, I saw this, and we still have an opioid problem, but now we have the fentanyl problem as well. And it's something that we all have to be aware of. I'm not a Cassandras. I hope 5 years ago, people will say, Gary, Yabuta, you were wrong. We never had a fentanyl problem. Well, we do. It's here. And I hope I could hear that 5 years ago, that it went away. But I have to be very cautious and give the information to our Hawaii people, thanks to you.
You know, I'm wondering, because you had mentioned that there are, of course, people that are explicitly seeking out fentanyl for an addiction or for some sort of substitution for something else that they may have been taking, like OxyContin, as you mentioned. But as you also said, that there are other cases where people unintentionally take another drug, say it is cocaine that's laced with fentanyl. I mean, the intent still is drug use, but not necessarily fentanyl related. But because there is this mixture, they are exposed to that. How many of those cases are we seeing here locally where it is those who are seeking fentanyl, or people who think they're taking something else and it ends up being a reaction to fentanyl that was laced within or mixed with another drug without that user knowing?
You know, I don't think today's drug user is very discriminate. I think whatever's out there, they're either going to try it for the first time, and they're going to experience a different type of high that they normally would have gotten had they just taken one drug exclusively. And you're absolutely right. More and more, our EMTs, our law enforcement officials, and our medical providers and our emergency room doctors are finding more polydrug overdoses. And for Hawaii, it's very common to have fentanyl mixed with methamphetamine, our biggest drug threat, methamphetamine. And you're talking about methamphetamine, which is a stimulant, and opioids is a depressant. Yet the effect of both of these type of drugs, which are pretty much antithesis of each other, is a high that people are popularizing right now in Hawaii. So you're absolutely right. We've had indications of fentanyl mixed with MDA, designer drugs. So anything's possible now.
Okay. And with that, I mean, our understanding with fentanyl is that it doesn't take much to have an overdose. Can you talk about just how potent this drug really is?
2 milligrams will kill you depending on your size. If you're relatively new to any type of opioids, and 2 milligrams is maybe the tip of your pencil. So very, very little it takes. Again, fentanyl is 50 times stronger than heroin. So it's just a little bit. And you have to worry about analogs of fentanyl, carfentanil, which is 100 times stronger than heroin. So the bottom line is just a very, very tiny bit. A pin drop will be a lethal form.
We heard a lot about this during the Halloween season, and there was warnings out there to parents to really advise and to monitor what children, of course, gather on Halloween. And we know that, as you mentioned, it's coming in multiple colors that are sometimes more attractive to the younger audience. How easy is it to mix up this as candy or another form? Because I imagine that it has become somewhat popular, knowing now that it comes in these different colored forms. But the drug makers of this are specifically targeting this as a potential drug for younger teens or for those youth. If you can talk a little bit about the appearance of it in its form in this manner and the dangers that it poses for parents when having to monitor children.
Yeah, and that's a good question, because law enforcement for many years are accused of using fear tactics, like in Halloween, to dispose of drugs that can be taken by children as a mistake. And so I always answered that question that, first of all, not only fentanyl, but any type of drugs nowadays, anything's possible. And so for parents, you have to be cautious with that, and that there is a low probability that someone would put a $17 colored fentanyl pill in a trick or treat bag for a child. Very, very low probability. But the risk is high should that happen. So parents have to make that decision. I always advocate is as you have to know your neighbors, you have to know your friends before you distribute or accept any type of candy or any type of material from people nowadays that are going to be consumed by a child. So again, that's my cautious position, and I'm not being one who is trying to scare anybody, but we have to be very, very careful in today's world, and that's the reality. And that's what I see on our streets.
Yeah, $17 is certainly expensive for Halloween candy, but for a drug of what you're describing, that seems like a very low price point. Is that basically the street cost of this drug?
Yes, it is. And you're absolutely right. It's relatively low. In fact, OxyContin, real OxyContin goes for about $25 a pill. So there's not much difference. And the distribution points come from the West Coast, and they're selling it for maybe $8 to $10. So by the time it gets to Hawaii, yes, it's more, but it's still cheap. It's never been cheaper. Fentanyl, counterfeit, OxyContin, methamphetamine has never, ever been cheaper.
As someone who's worked in law enforcement and you know the processing and what it takes to prevent this from happening, from getting to the root of these drug dealers and the webs that occur on the black market, what can you tell us about what is being done here locally to prevent fentanyl from coming into the community? What efforts have been taken by law enforcement to not only just catch up and acknowledge who these people are and where they're coming from, but to stop it from entering our communities as a whole?
Yeah, we're trying a variety of tactics, actually. Like anything, we see the threat, we identified the threat, but what do we do with it outside of law enforcement? Because law enforcement, and my primary job is to arrest drug traffickers, put them in jail, punish drug traffickers for selling their poison that are killing our people here in Hawaii. But as far as preventing drugs, it's been relatively new to law enforcement officials like me, and even public health and medical providers. You want to find that miracle PSA, public announcement, public service announcement. You want to find that perfect commercial that will wake up people and say, no, I'm not going to try drugs. I know what drugs are now. I know what fentanyl is. I'm going to stop taking it by virtue of this public service announcement, this PSA. I'm not trained for that. I've tried everything I can. And what I have found is that our best vehicle is education, like what I'm doing now and what you have provided me to do. We all have to be role models. I always advocated that we all have to have parents that teach their children not to do drugs. Well, if you had parents like mine who are uneducated, came out of a World War II Japanese American prison camp and had to work for a living, they didn't know about drugs, and they were too busy working to really tell me don't do drugs. Well, there's a lot of parents like that in Hawaii, a lot of immigrant parents. And there's a lot of parents that just don't know about drugs. So we have to step up. We have to be the role models. Our teachers are role models. And I'm trying to be a role model today. And you're a role model by allowing me to give this information out there. So everybody in the community has to be a role model and basically get the information out and refer that information to people like me that have the facts and educate our people, and especially our youth, on our poorest and our uneducated people, and people that have English as a second language. They're the most vulnerable. So we have to concentrate not only on everybody, but those people that are most vulnerable. But again, we have to all be role models.
Yeah, and I think having this conversation is so important. We are almost out of time, but we are heading into, we're in the holiday season, not heading in there. We're there, and people are socializing more. Of course, with New Year's Eve comes a lot of parties, and there is this feeling that we're, back socializing after 2 years or so of the pandemic. What's your message to people as they get out and they get more social, and what are your concerns about parties and whatnot when it comes to this drug in particular?
Well, when you have trauma, people are susceptible to try drugs and to get hooked on drugs, become addicts. And we are in the crossroads right now with the COVID-19 epidemic. So we have this new generation of people that have been traumatized by COVID-19. I'm not a sociologist, but we have to be very, very cautious about how people are going to be reacting for many years to come, having been experienced with COVID-19. We're going through an economic problem right now. Jobs are scarce. People are out there without the money to have housing, to have food. So all of this is manifesting. And so this trauma is going to encourage drugs. And so we have to be very, very cautious about that. And really, get out the information. Everybody has to come out and try to find that miracle PSA, that miracle messaging, and just try to help people during this crisis.
Before we let you go, this is a lot of information, and I'm sure there's a lot further details. If someone's out there watching and would like more information about fentanyl, the effects, what they can look out for, what would you say is the best resource for those individuals who want to learn more about what's happening here?
Yes, we have the Department of Health, which I'm a proud member of being a part of, the Opioid Abuse Initiative, the Hawaii Opioid Initiative. Look them up on the website. They'll give you all the information that you will need to understand fentanyl and the dangers of fentanyl and how to get help. You can also call the Hawaii Cares hotline, and they changed the number to 988. And that line will take care of all hazards, whether it's suicide, ideation, drugs, awareness, household abuse. We'll get you to the right people. And that number, 988, will refer you to whatever you will need. And now, if you can't get that help, my number here at my office is 356-4403. And I'm willing to talk to anybody in any audience about drugs in general or fentanyl. And that's what we all have to do. And the media, like you folks, have been doing a wonderful job getting out the information about fentanyl abuse and the dangers of fentanyl. And unfortunately, there's factual evidence that people are dying in Hawaii from fentanyl abuse.
Okay. Well, Gary Yabuta from HIDA, thank you so much for your passion on this issue. We appreciate your commitment. We hope your phone is not ringing off the hook today, but we do know that people will engage with you, and we appreciate all you're doing for our community. Happy holidays, and thanks for being here.
Well, thank you for both being role models. Thank you.
Thank you.
Great to hear from him, Ryan. And this is such a serious issue. I think that, when he talks about all being role models and the public awareness piece is really essential, especially for parents, and talking about the danger of this drug in particular. Drugs have changed since those parents were perhaps going to parties themselves. And this is such a lethal substance, just 2 millimeters, he was saying. The tip of a pencil can be enough for some people to overdose. And they may be doing it unknowingly. Perhaps they think they're taking another narcotic, which is, of course, not something that we advocate, but perhaps they're trying a different drug, they think, and they encounter this one. It does sound, though, that Narcan is something that we all need to get a lot more familiar with.
Yeah, and you heard him talking about the response from EMTs, both here on Oahu as well as throughout the state, and how often these EMTs are having to use it when approaching a situation. He said over 1,000 cases were actually reported where it was some sort of drug-related issue where a Narcan was used and really has come in to save people's lives. And so he talked a little bit about, interesting to hear in California, how schools are requiring that to be something that is included within the school system and on campuses. And unfortunately, those are the times that we live in where those types of equipment and services are provided and have readily available to help in those types of situations. But it is becoming a threat. We've heard more and more about it. Of course, as we mentioned, over Halloween, there was a big push to make that awareness in the community about the impacts of fentanyl and just how much more prevalent we're seeing it within our community.
Yeah, and also what struck me is how cheap it is. The idea that you could buy a dose for $17, that's not a high price point. And of course, that means that there's more opportunities for entry into the market there. So please do tell your friends and family to be wary of this drug this holiday season. We know we're all gathering and socializing, and there are more opportunities for those kind of encounters. But if you do see that, of course, make sure to call 911 and get the Narcan as soon as possible if you suspect a fentanyl overdose, because time is of the essence. You really don't have much with an opioid overdose. We appreciate Gary Yabuta, and we appreciate all of you. Coming up on Friday, we're switching gears and talking with City Council Chair Tommy Waters. The City Council is facing a lot, including looking at the gun restrictions, what we talked about with Chief Logan, and that article that Peter Boylan wrote following our interview got a lot of comments. So we know that there's a lot of back and forth in our community about the City Council's measure to restrict guns in sensitive places. We're going to be asking Tommy Waters about that, plus a lot more.
Yeah, new council coming into play here with the elections that are now over and a new council members that will be entering into office, the new personalities involved. Of course, Chair Waters leading the council and assuming that he will continue to hold that position. We'll talk to him about that new makeup as well as budgeting issues and some of the other things that currently the City Council is tackling. Always a lot going on at the City Council and at Honolulu Hale. So looking forward to catching up with Chair Waters. We hope you'll join us right here for another episode of Spotlight Hawaii on Friday at 10:30. Until then, take care and aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.